Good afternoon, everybody, and welcome to this conversation with Lyndsey Gilpin. I'm Joe Waters. I'm the co-founder and CEO of Capita, and we are thrilled that you are here, and we're thrilled to be in this conversation with Lyndsey. Just one note, we will be taking your questions here in the next few minutes. So if you look use the chat box, please submit your questions that way. Also, Lyndsey's bio is available on our website, capitasocial.org, and also here on the webinar site. So I'm just going to jump right into our conversation with Lyndsey. Lyndsey, thanks again for joining us.
Thank you.
You shared with me today an article in the Atlantic by Van Newkirk that draws attention to some of the particular toll that the coronavirus is likely to take in the American South, particularly on middle and working age people. And I was surprised to see in there that I think 1 in 10 deaths, correct me if I'm wrong about that, 1 in 10 deaths so far have occurred in Louisiana, Mississippi, Alabama, and Georgia. And of course, we're particularly aware of what's happening in Louisiana and New Orleans, but also in South Georgia. So based on your reporting and Van's reporting, why is that?
So this story was really interesting, and I'm so happy that Van wrote it because he does great work on Southern justice issues in general. And I've been kind of waiting for this story because we've seen the pandemic kind of sweep further south, right? And the governors of the states sort of finally putting stay-at-home orders in place and that sort of thing. Like Florida just did it very recently, Georgia recently. So basically what this story lays out is the fact that, this isn't like an innate Southern problem that that people from our region are dying more frequently from COVID-19. It's the fact that it's a policy problem, right? And it's also a demographic issue. So some of the things that he said, which I often talk about, is the South is the poorest region in the country. Poor, Black, Latinx, rural residents all make up part of this region. And he has a stat in here that it says Mississippi, North Carolina, Texas, Florida, Georgia, and Louisiana all spend less than $25 per person on public health a year, compared to $84 a person in New York, which is just mind-blowing to me, right? And that, it's not mind-blowing in the sense that it's surprising, because a lot of us know the kind of the reluctance to, or the refusal to, expand Medicaid in southern states by a lot of these GOP governors. And then you have the issue that there are people that can't access hospitals, can't access healthcare, live in rural places, live in economically distressed places, whether that's the Mississippi Delta or Appalachia. And one of the other important things about this story is it points out that most of these deaths in the South, or more so than other regions of the country, are younger and are working age people, as opposed to the high risk category that's often talked about with COVID-19, which is, above 60. And so that's really interesting. The South is the fastest urbanizing area, or the region of the country. It's incredibly populous, and a lot of that is Black and brown people. And so because they're working a lot of these people are working lower wage jobs, are working in what is now called the essential industries. We're seeing that they're more at risk of coming into contact with the virus. So it's kind of scary to see.
So let's talk about Michael Barbero's tweet from earlier today. So Michael Barbero is the host of the New York Times Daily podcast, and he tweeted a map.
Yeah.
And I'm going to ask you to describe that to us. But in particular, what I'm really interested in is what that says about food deserts in the American South, and accessibility to good, nutritious food, which is obviously something which is an issue for all of us, but especially for families with young children, and how this really sort of maybe causes us to think differently about social distancing, and really thinking about social distancing even as a luxury that's just not available to poor poor, lower income, and more remote communities in the American South.
Yeah. So the New York Times actually came out with this story today that's actually really interesting and displays a lot of data that they gathered. The map that you're referring to that was on this tweet from Michael Barbaro was just a picture of how long it had taken people to drive less than 2 miles or less, depending on by date. So it started in the middle of March and went to March 26th. And if you look at it, all of the South is red, and red meant that they waited until March 26th or later to stop driving 2 miles. And there was no real context to the tweet or to the map. But if you read the article and then looked at other maps, it was county level data that showed food deserts, access to food, showed sort of how long people were driving, or what really when the state started taking action and forcing people to stay home. It actually went viral on Twitter, like several tweets kind of back to his kind of saying that the South just it implied that we were just at fault for not taking this seriously, which is just a huge misconception and perpetuates the inaccurate stereotypes of this region in general. So if you look deeper into the data, that data that he had pointed out was based off of cell phone towers, which is interesting in itself because cell phone towers are generally in more populated areas, in areas where, there were not cell phone towers where I used to live in the middle of Eastern Kentucky, where I had to drive 20 miles to get to a grocery store, right? So that isn't totally accurate, and it's not really showing all of the things you have to take into account. The other thing I think is important to think about with this data coming out is that in the South, like you just said, there's a lot of food deserts. So people are, whether they're in a rural area, right, and they're having to drive, like I said, I did 20 miles to a grocery store, or their grocery store is the Dollar Tree, which is incredibly common. Or their farmers markets were shut down because of the virus, or their kind of services to deliver fresh food, that sort of thing. Or even in urban areas, right, where you have, in my hometown of Louisville, there's no grocery store in the predominantly Black area of town, and that's a very common story across the South and across the country, of course. But I think in the South, it's exacerbated by the fact that you do have a lot of Black and brown people, and you do have a lot of rural people, and that is just kind of compounding this problem of if we just blanket say that the South is not responding to this crisis, that doesn't take into account how far people have to drive, how much internet access they have. The South lacks a lot of internet access in many of these rural areas, some of the worst rates in the country. And the fact that people aren't getting enough information just in general, whether that's from their elected leaders or from the internet that they're trying to find out CDC information or something. So there was a pretty good conversation on the internet today about what kind of the nuances of that. And I actually think the New York Times changed their main photo for that tweet to a different map that showed more nuance, thanks to several of my colleagues in the industry that pointed it out. So that was good to see.
So on that, one of the reasons that I think you founded Southerly was to provide a little bit more nuance in the coverage of the American South and coverage of issues around justice, equity, climate change, public health. So just tell us a little bit about Southerly, how you got started, and maybe also what you've sort of discovered over the last, I think it's almost 2 years that you've been running Southerly, particularly about public health. And I noted that I think your very first story was called The Rural South's Invisible Public Health Crisis. And here we are in a global public health crisis. So I'm just curious what you've discovered over the last 2 years.
Yeah, that's interesting to point out. I'm glad I haven't thought about that. So I founded Southerly as a newsletter, actually, in early 2017, end of 2016. I was out west at a magazine report called High Country News, reporting on environmental issues and climate change and that sort of thing. And it was during the election, and I kind of talking about these stereotypes. I saw really how how the South was blanketed as just Trump country or, backwards, the typical things that we hear all the time if for whoever's watching that is in this region, and was sort of blamed in general for what happened in the 2016 election and whatever happens after it. So I decided to move home. I'm from Louisville, Kentucky, and I moved home in early 2017 and started Southerly as a newsletter. So I basically was curating like local news that I saw in the region that people were overlooking or wasn't making big headlines, typically related to environmental issues, whether that was pollution or climate change or energy transitions or sort of how local economies were changing. And in the middle of 2018, I launched Southerly as a news organization, and now we are a nonprofit. And basically, the tagline is ecology, justice, and culture in the American South. And what that means really is the relationship people have to their natural environment, and how complicated that relationship is, how it's changing, how it's stressed, how we affect it, how it affects us. And so we tell stories, everything from, the invisible public health crisis you were talking about was basically in the rural Black Belt. A lot of families do not have proper sewage infrastructure, and so they
Just clarify, Black Belt is what part of the South?
Black Belt is the region in sort of like the Mississippi, Alabama, where this is named that for the soil that it was there at, during the civil why slaves were there, and but it does have a disproportionately high rate of Black people living there. So I think a lot of times people get confused about that. It's very rural. And so we went to a little outside Montgomery in Lowndes County, which is actually, where the march from Selma to Montgomery is through most of this county, and found out that most people are straight piping they flush a toilet and their sewage goes out into the yard because they don't have a septic system, they can't afford it, and the city or town or county has not brought in infrastructure to give them proper sewage systems. And so there's a lot of public health issues related to that, as you can imagine. And one of them that's rising is hookworm. There's high rates of hookworm in the area, especially among kids. And so I went down there with a journalist friend of mine, and then worked with the local newspaper down there. And this was Southerly's first series of stories. And we kind of focused on the problem, which was that, there was not enough engineering to kind of figure out how to fix this problem. There's not enough money. All these community activists have been working for years and years to get this fixed. And then we talked to scientists developing like a hookworm, trying to figure out a vaccine. How do we educate kids more? That sort of, so that they're not running around barefoot outside. And then we looked at the solutions that were possible from that, and comparing it to other areas of the world that have dealt with parasites, things like that. So that was kind of the first big project that Southerly did, and it launched sort of the model that we have now, which is to cover how the relationship between people and their natural resources, and then also partner with local news outlets to make sure that Southerly is not just preaching to the choir online, like on Twitter, like I was just talking about. That is not my goal. So pretty often we've done a couple of partnerships with public radio stations, community newspapers, and like rural areas, community newspapers in rural areas, and Gannett newspapers and the newspapers. We've also we're working on a partnership right now with the Spanish language media to get the information that people lack out to these places that are underserved, that are in news deserts. Whether that's because the major paper has just laid people off, or because their community papers have had to shut down, which is happening more. The corona is spreading and hurting ad revenue. So we're trying to kind of change the media ecosystem at the same time journalism, and doing that with a group of reporters and writers and artists and photographers that are based in the South and are writing of the place and care about and want to nourish.
Great. I did want to just ask you to help make the case and I'm going to tell you the case I want you to make, but I do want to just remind everyone that if you have a question for Lyndsey, please consider putting that in the chat box. But the case that I want you to help me make is the case for why those of us who are concerned principally with the well-being of young children and their families need to be tuned in more to the type of work that you're doing around the environment, geography. I mean, you just referenced hookworm. I mean, I think that's a great example, but go a little deeper. And why do we need to be thinking of ourselves, those who typically think of ourselves as early childhood people, why do we need to be thinking of ourselves more as environmental, ecology, climate justice people?
Yeah, it's a good question. And I think one of the biggest concerns I've always had, and it becomes even bigger as I've begun doing this work and started talking to more people throughout the South, is that up until now, up until very recently, the environment, everything related to the environment, whether that's pollution or climate change or the coal industry, whatever it might be, renewable energy, all of that is typically written about sort of like in a silo over here. And then there's everything else: business, health, the economy, education. And what we're seeing more and more as we see the effects of climate change, whether that's, historic flooding in Eastern Kentucky or a tornado. Well, you can't tie tornadoes specifically to climate change, but erratic weather and leading to really big storms in Nashville or Middle Tennessee, or hurricanes along the coast, is that all of these things are so intricately tied together, right? So we, as a society, have to sort of come to realize that everything that we've been doing to the land, whether that's through extractive industries in Appalachia or like farming practices in Arkansas, that affects our local economies, right? It affects the health of our of people. And specifically, and to your point, I think, and I actually don't think this connection is made enough with looking at children, because a lot of times you hear in the environmental movement, like, we're doing this for our grandchildren, we're doing this for the future, we're doing this because they're the ones that are going to have to see the effects of climate change in 2050. We have an idea of what that'll look like, but it's incredibly scary to imagine. So like, let's protect this world for them, right? You see the young climate activists sort of getting attention, but you don't really see how that's tied into like what is happening now. It's sort of like, okay, well, let's just figure out how they deal with it down the road. And I think if we start really understanding and talking about more openly how that with this crime. And so like one example I think is like climate in schools. This is a little older than what you're talking about. But chemical facilities in Louisiana or coal ash landfills, things like that. I mean, those are causing high rates of asthma, causing respiratory diseases, causing, the hookworm thing in rural Alabama is another example that affects a lot of early really young children. All in this, whether you're in the Mississippi, in Appalachia, similar effects on our economies and on our health and on our education systems that are all stressed because of the changing climate and because of the health risks caused by extractive industries.
Great. Thank you. We have a question. What have been some examples that you've seen recently of helpful and harmful ways to approach food security during the coronavirus?
Yeah, that's a good question. I've seen a lot of stories in the last couple weeks about figuring out how to get food to more vulnerable populations that shouldn't be going to grocery stores at peak hours or can't make it to like out of their house, that sort of thing. So I've seen a lot of sort of organizing around bringing like mutual aid efforts. For instance, in like Eastern Kentucky, there's a lot where they're kind of organizing to go for younger people to go to the store during this time, and then bringing those items to people's houses or dropping them off on their porch, that sort of thing. There's several efforts around Durham here, where I am now in North Carolina, where farmers, since they can't go to farmers markets, they're doing their CSA programs a little bit differently and trying to work together. There's been like a spreadsheet just to show what they all have and how you can arrange a pickup and that sort of thing. And actually, I'm really curious to see who that reaches, because you just have to wonder, like, okay, if the typical people going to the farmers markets were white and middle class before, like, how do you reach right? How do you reach lower income areas of a city now? So I'm not totally sure like what that looks like, and maybe that's something that we'll be able to see in a couple of weeks or in a month or so. The other interesting thing with food security is just the sort of the creative ways, I think, that, and I don't really know how this will manifest either, but what farmers are going to do in these areas of the South that are that missed all of last year's crops, like in a delta because of flooding, and like how those people are going to kind of reach buyers of their food, or what their crop yields look like this time of year in 2020. And I've seen several things on Facebook. I was following a group or a company in I think they're in Biloxi, Mississippi, that they were selling big boxes of like apples or lettuce or things like that to whoever could afford it at a reduced rate. But some local farmers were like, well, we're trying to sell the same thing, but we don't have a farmer's market to go to anymore, and we don't have the same reach. So yeah, it's been interesting to see like how that competition of that shakes out. I don't know how harmful that would be in the long term.
Yeah. So another question here about some common misconceptions about the needs of rural healthcare. So can you just speak a little bit about what you've seen in terms of rural healthcare? I know my home state, South Carolina, we lost quite a few hospitals after some floods in 2015. That's been a persistent problem in some rural parts of the state, like Williamsburg County. So just curious what, particularly at this time when we're going to need a strong healthcare infrastructure, what is that looking like right now in the American South?
Yeah, I was looking at this. One of my friends who works for Facing South, which is out of the Institute for Southern Studies, did a really great piece. Actually, I can probably put it. Hold on, I can put it in the chat. On the state of rural healthcare in the South. And she wrote that the rural South has lost more than 3,500 hospital beds due to hospital closures since 2005. And there's a map in there that shows when it really ramped up, because obviously rural America in general is losing medical centers and hospitals. But 2010 to present day is sort of like it gets very, very fast. All these closures, and I just read about a hospital closing in West Virginia because they just don't have the resources and the money the investment to make it work. And a hospital this was like this week, and then a hospital in Kentucky that's furloughing like 300 employees because they can't afford it. And this is obviously in a state and in an area where there's already just a really they're hurting for more resources. And I think Savannah asked about the misconceptions. I don't know. I don't know if I'm the best person to speak to this because I'm not a healthcare reporter. But I do think that we oftentimes hear this story about, oh gosh, it's declining in rural America. We don't know what to do. there's just story after story about how dire the situation is. And I think this is true for a lot of things in the South, that we're just like pummeled with that story so often that it gets kind of like your eyes sort of glaze over after a while, and you don't really understand the kind of what has to happen to change that. And a lot of that is policies and at the state level or at the federal level, but I do think that this is a huge issue, and even still with the coronavirus, you're not seeing as much attention on rural areas as urban areas right now. And I really don't know if that's going to change, because that's just what the sort of media at large focuses on. And at the same time, with the rural hospital closures, you have media in rural areas declining or absent. And that's especially true in the South, where there's a lot of news deserts, which means they don't have a consistent newspaper or news outlet covering them. And when you don't have watchdog reporters looking at why is this hospital closing, or what's going to happen to these doctors, or who's leaving and who's practicing medicine, how are women getting healthcare, where are they having babies, all these questions, you don't get the answers to those, right? When you don't have journalists there to ask them. So I think that's kind of that's a relationship that could be looked at even more.
So you've been profiled among a rising crop of young Southern journalists who I think it was in the New York Times, right? Who are leading the way for a new journalism for the New South. Can you just speak a little bit about news deserts, new models of journalism that you're seeing? And in particular, I'm interested in, and this is a question I think for journalism broadly in the Trump era, but sort of the degree to which you feel like you're an advocate or a proposer of solutions in your journalism.
Yeah. I know the mentioned, there are a lot of, I wrote a story pretty recently on news deserts in West Virginia, and North Carolina, where the route of this big pipeline project was proposed to run through 600 miles. And there are several counties with no newspaper at all on that route, and several with one weekly newspaper that serves like 2 or 3 counties. So when they're doing news, they're not having someone in their community talking to people all the time, or even living there. They might be living in the next biggest city. And so you see this. So there's this decline in smaller community newspapers that just can't survive because they've been based on ad revenue, and there's the internet, and there's no need for ad revenue in print. And then you have the consolidating corporate media. So, Gannett and McClatchy, and there's a lot of great journalists doing amazing work at these places. But the fact of the matter is, like Gannett this week, because of the coronavirus issues, decided to furlough all their employees for 1 week per month until June, that's so many newspapers. It's insane. And you can't do good work when that's the case. So there's kind of an outpouring right now of support and like a groundswell effort with nonprofit news that focuses on grant funding, and foundation funding, but also membership programs where, hey, like I'm a member of this community because I love it and I know that news is important and I need to support it. And this is what I get. I get like to access to more information or more stories, or like a behind the scenes with a reporter, or even like a special newsletter or something like that. So I chose the nonprofit model for Southerly because of that. I mean, the nonprofit funding world is like very similar to the for-profit world, where like a lot of money goes to like very few amount of places, and then the rest of it, like everyone's fighting for scraps. But the membership model makes sense to me because we have to get people to appreciate journalism again, right? Like I think that's happening sort of in the era of like Trump and accountability and making sure that this administration is held accountable, but like more so than previous administrations that I've seen. But but there's still the fact that like the internet came about and people got information for free, and now it's reconvincing everyone that they should pay for that information if they want quality journalism. And this, at the same time, you have sort of like fake news and misinformation spreading on Facebook, that sort of thing. And that makes it really difficult. But there's a lot of great examples, like in Mississippi, there's Mississippi Today News, which is digital, but they hosted a lot of events and like public newsrooms where they engage people in their towns. There's great collaborations in North Carolina here between like the News and Observer, which is a McClatchy paper, kind of a legacy publication, and like the Spanish language newspaper Enlace Latino or in Southerly, that sort of thing, where there's less resources out there. So how do we work together to make this work? And that's really exciting to me because I don't see a way forward without doing that. And because it doesn't look like it's going to get any easier to figure out to recreate the old journalism model. We're not going to get ad revenue again. We're not going to just like hire people to work staff newspaper jobs. So what do you do in place of that? And I think these kind of creative nonprofits are really interesting. But to your point on the advocacy thing, I asked this a lot because when you write about environmental issues, people just assume it's like an advocacy magazine half the time. So I'm like very careful with one of the things that Southerly does is like talk about climate change. We talk about the science of climate change, for instance, but in a way that's accessible to people, because at this point, I don't care what people call it. They'll talk about flooding. There's, like an old guy in Eastern Kentucky will talk about his property got flooded, but he, doesn't want to engage on climate change. And that is whatever, like if you just talk about what to do with the situation and how you need help and what you need from the government or nonprofits or whatever, I think that conversation is really interesting. And that's sort of like where Southerly fits into the realm of talking about the environment rather than just beating people over the head with statistics. But I do think there was this myth of objectivity in journalism for a long time that still persists. And that myth is just based on the fact that newsrooms were white and male, and that they were just like a blank slate and kind of like called it as they saw it. And obviously we know that's not true, because everyone comes into whatever they're doing with a bias of some kind or experiences that they've had. And so as the industry has opened up more to minorities, to women, to LGBTQ plus folks, like all of these things, all these different groups, then the narrative shifts a little bit. And sometimes that's advocacy. Like there are great advocacy magazines that kind of like really push for an agenda. And then there's just journalism that like calls injustice out ethically, right, and backs it up, but sort of calls it, like we see it a little bit more. And I think that latter part is where Southerly falls sometimes. Like justice is a huge focus of what we do, and but not in a way, at least what I try not to do, is alienate anybody from that conversation, because we can all sort of agree that to your point earlier, that like we want to see children succeed, right? Or we all like public health is a perfect way into a lot of environmental conversations, where someone might think you're kind of like advocating for some sort of climate change policy. But if you go into it of like, hey, look, no one here has access to clean water because of the coal industry, let's talk about it that way, then that sort of moves it forward a little better. And so that's sort of how I think about the advocacy aspect of it. And I mean, I would like to see this planet thrive, right? And like the communities in the South thrive, mostly because they are at a disproportionately affected by the consequences of climate change. And so, and I think to do that, we need to get more information out to people.
Great. We have a question here about how we can build upon the resilience of rural families to best support them in their role as parents and as their child's first teachers when there's so many headwinds.
Yeah, again, this isn't my like reporting forte, but one thing that I see a lot and hear a lot from friends of mine that report on education and children and health is in rural areas, there's just a lack of childcare. And so you have parents that are juggling to do a million different things and work jobs that, are in these industries that aren't paying well. And so that's like when the coronavirus hit, that was a major concern for a lot of people in rural Appalachia, for instance, because they were just like, what are we supposed to do, right? And also the fact that, in a lot of rural, one thing that strikes me is, and it's related to that, is in rural areas, there's not a lot of resources for like early education, and there's not a lot of resources for parents who need help or want to do, like, educate themselves to do a different career rather than like working at like in the coal industry or working at Walmart, or things that are like low paying and time consuming and put them at a disadvantage for like kind of moving forward in their careers, or being able to provide a solid, affordable, like living for their family. And so I really believe that it's sort of like a multifaceted approach, I guess, where we just have to support parents more. I mean, there's no paid leave, right? That's not a national issue. There's no paid maternity leave or paternity leave. And that's something that that affects rural communities more and minority communities more. So I think it's sort of looking at that, and maybe the shorter term solutions are, I don't know. That's so hard. Like, it's just paying more attention to rural areas and what they need.
One thing I was thinking about earlier today, because here in North Carolina, Governor Cooper was having a press conference. It was on NPR stations. And for the first time that I had heard, he had brought the commissioner of the prison system to the press conference to talk about the number of coronavirus cases now in the prison system, both among offenders and also employees. And I was thinking about that in light of this conversation that we're going to have about how so many of the prisons in the American South are located in these rural, low-income, disadvantaged places. And if you are a prison guard, you can't exactly telework, right? And it just, that to me was a sort of crystallizing moment in terms of some of the inequities with families and economic justice, but also how it's tied in with the prison industrial complex. Of course, the South incarcerates more people than any other region of the country. And I think at one point, don't quote me on this, but I have heard this throughout my life as a South Carolinian. South Carolina incarcerated more people per capita than any other state or country in the world, right? And so I just want you to respond to this linkage between public health, economic justice, and the prison industrial complex, which really is cited in rural, underserved communities in the American South.
Yeah, I was thinking about that statement in North Carolina too, the prisons. And where I used to live in Eastern Kentucky, there was a prison pitched. I wrote about it a few years ago, 2 years ago, I guess. That was pitched as sort of an economic solution. Like, coal mining is going away. Let's build a prison here, and we can hire people. We won't really tell you how many, but we'll hire guards or whatever, and it'll be out of the way. And it's on a former mountaintop removal site, mining site. And the organizers who worked to get this project stopped were successful, and the government pulled the company, and I was a federal prison, so the government pulled this out of the budget last year, I believe. And that was a lot of work. It was like years of work on the ground of people saying, no, we don't want this. This is not helpful for our community and not the kind of sustainable economic development we need. And I just mentioned that because I think it's an example to show that there is a lot of work happening to stop these sorts of these history from repeating itself, basically, with extractive industries in these places, because one company comes in to say, we'll save you. Here, we'll build a pipeline, or we'll build a natural gas project, or an industrial park that will be built in 5 years, and in that doesn't really account for the fact that there's not many people that are going to be hired by that, or they might be from out of town, that kind of thing. So I think it's on its face, it sort of seems like these ideas of justice, and economic justice, and public health and the environment are separate. But and that's why I think good journalism is really important in this, is that it's incredibly confusing and it's difficult to talk about it. It's hurtful sometimes because it's painful to see, but they're just inextricably intertwined, because whatever happens to the land which we live on, and the geographic region that we're in, affects our livelihoods and our health outcomes, and the health outcomes of people that, whether they're in a prison or working in a coal mine, who are kind of basically building the economy of a place on their backs, right? And I think that kind of connecting the dots, again, I say that a lot, but I think it's really important to sort of reiterate, is that connecting the dots between those things are just going to be even more important as we see, because every time a new, whether it's coronavirus or climate change, right? It's so overwhelming and abstract sometimes, where you're like, what is the world going to look like in 6 months? And so I think breaking it down to show at the community level how the prison system is related to, the coal mining system is related to the economics of Kentucky, or in your case, South Carolina, what that looks like, really helps people understand and grounds it more, so that it makes more sense, I think, because it's difficult.
Yeah, thank you. There's a question here about communities thriving and what needs to be addressed to help communities thrive. And I want to ask you to respond to that, but also think about and respond, if you would, sort of 5 years from now. I know that we seem to be living in some sort of crazy time warp, but we're always interested in the future, and I'm curious what is hopeful that you're seeing in communities in the American South that might suggest some resilience and a brighter, better future 5 years from now.
Yeah. I'm glad this was asked, because I feel like a lot of times in my line of work, especially right now with the coronavirus, it's all doom and gloom, and I like to focus on what people are actually doing to respond to these challenges. 5 years from now, I sort of operate under the framework that, and I'm not sure, I think it's becoming more common, but I operate under the framework that the world is going to be drastically different even in 5 years. I mean, because of climate change. Now because of the coronavirus too, and global health pandemics, but all of that is related. Sort of how this country reacts to this pandemic, and how we react to whatever comes after it, is going to drastically change what's going on. And I don't know. I feel like I would have answered this question differently, in February before all this hit. But it is. I am hopeful that there are, like I said, even if it's not in the vein of an environmentalist, in a movement or protesting or, stopping a natural gas project or whatever it is, there's a lot more people aware of what is happening to our world and the injustices that persist, whether they're environmental injustices or economic injustices or health injustices, and that I've seen in my reporting and just in running Southerly and sort of talking to organizers. And I mean, this has been going on for decades, right? Where people have been working to draw attention, to shed light on what is happening to their communities and how to fix it, to whether that's hold people in political power accountable or hold companies accountable, that sort of thing. But that it just feels like it's come to a head enough where there's no other choice, and everyone's been affected at this point. And I think the coronavirus pandemic proves that like we're all sort of in this, and we have to figure out what comes next. And like, that's a very difficult thing. And so I think I'm really inspired by a lot of the work I'm seeing in like coastal states to protect communities like Native American communities or other low-income communities of color from or schools, things like that, from sea level rise, or educating people about that. And another really interesting thing I've been following lately is sort of the farm worker justice effort sort of in North Carolina and across the South, of how better, because of all of this rhetoric in this country against Latinx people, and specifically undocumented immigrants, like what that looks like for the people working now, and also their families and their children. And so I'm really excited to see sort of what comes next after this, because I think climate change is that's the next big thing, right? That we have ignored, and then this happened, and we're like, okay, well, we'll have to deal with that later. But I really believe that that things are going to have to change, and I think a lot of people on the ground, whether or not the media has shown that or not, have already made a lot of steps towards protecting those around them and protecting their land and taking care of each other. And I think that makes me feel excited and hopeful.
Great. Well, thank you, Lyndsey, for your time today. We are going to wrap up here, but before we go, I have two questions that I want you to answer. First of all, tell us about the Wendell Berry poem you've been reading this week to get you through the coronavirus. And secondly, tell us how we can subscribe to Southerly and learn more about Southerly.
Yeah. Okay, so I'm from Kentucky, as I mentioned, and Wendell Berry is from Kentucky, and I adore him, as most people do, I think. So I was telling you earlier that I've been reading a lot of Wendell, or I said in my newsletter this week that I've been reading a lot of Wendell Berry. I've been reading It All Turns on Affection, which is one of his essays, but also Manifesto, the Mad Farmer Liberation Front. And it has a quote in there that I'll just say the couple of lines from it. It says, "Put your faith in the 2 inches of humus that will build under the trees every 1,000 years. Listen to carrion, put your ear close, and hear the faint chattering of the songs that are to come. Expect the end of the world, laugh. Laughter is immeasurable. Be joyful, though you have considered all the facts." And I think that sort of speaks to, I don't know, keeping hope even when things get difficult, and really appreciating what happens when we respect each other more and we take care of our communities, when we take care of our, the ground we walk on, and sort of like resist to do things because they're faster or more profitable. Wendell Berry always speaks well to that. So yeah, so that's just something to think on. And Southerly, so you can go to our website, which is southerlymag.org, and read all our content for free. If you happen to know like a newsroom in your community that might want to partner with us, or has stories that might be interesting to us, that we could share in our newsletter, then feel free to reach out to me. My email is on the website. We have a newsletter I send out every Thursday afternoon that has sort of news about the region, and not just environmental news, but looking at everything that we've talked about today. And yeah, that's free to sign up for. You can donate on there too and become a monthly donor, or just a one-time donor. southerlymag.org/donate. And then the other thing is, I have a tip form up on the site right now about trying to figure out how COVID-19 is affecting communities in the South. So anyone who is listening or knows anybody else that might want to fill that out, I'm just really interested to see how people are responding, what they're doing to like stay resilient in this time, how they're helping each other work through, especially rural communities and underserved communities. So if you are interested in that, that's on the site as well, to fill out and just send it to me. And it's confidential right now, like unless you say otherwise. I'm just really curious to sort of hear from people and maybe get some story ideas from it.
Great. Thank you, Lyndsey. Thank you for your time. Everybody, we will be back. Capita will be back on this platform next Wednesday at 11 a.m. Eastern with a global conversation featuring Nicole Biondi from Innovation Edge in South Africa, Shuka Goyal from Imaginable Futures based in London, Lyman Stone, a demographer based in Hong Kong, and Elliot Haspel for a conversation about flourishing futures in the pandemic and beyond, starting to think to the next, what comes next. So you won't want to miss that. That's 11 a.m. Eastern time next Wednesday. And of course, all information about that is at capitasocial.org/events. So thank you all for joining us. Thank you, Lyndsey, for your time and for helping us keep our attention and focus on the flourishing of communities in the American South, and in particular in rural and underserved and low-income communities in the American South. So we look forward to connecting with you again.
Thanks, Joe. Thank you, everybody, for watching. Bye.